Welcome. Thank you for joining us today for our discussion on COVID-19. We've been doing these town halls for nearly 4 months, and we appreciate those of you who have hung with us or who might just be tuning in now to talk about the current status of COVID in Arlington. For our discussion today, we have several members of our executive leadership team with us: Deputy County Manager Jim Schwartz, Dr. Aaron Miller, our Director of Emergency Management, and our Director of Public Health, Dr. Ruben Varghese. We are also joined by a special guest, Lisa Fikes, who will share more about Volunteer Arlington, one of our many partner organizations, and about the opportunities that you have to volunteer in the Arlington community during this challenging time. So before we launch in with our guests, let's get started with a few highlights. We have now been in phase 3 since July 1 for just 10 days, and it does appear that some of our metrics are starting to stall in their decline. In the past few weeks, we've seen small upticks in new cases, hospitalizations, and deaths, but we are still in lower levels than we saw earlier in the pandemic, back in late March and early April. Our testing continues to increase. As of July 8th, approximately 20,500 COVID tests and nearly 5,000 serology tests have been administered here in Arlington County. And on Tuesday, we resumed operations at the drive-up site on Quincy Street. That's now in partnership with Quest Diagnostics, as Virginia Hospital Center returns their staff back to their primary duties. Also important, we have created more opportunities for testing in Arlington's uninsured and underinsured communities that are hardest hit by this pandemic through our walk-up testing site at the Arlington Mill Community Center. As always, we encourage you to visit our COVID webpage, arlingtonva.us/COVID-19, to see other testing locations available in Arlington, as well as all the other latest information on the pandemic. Starting today, July 10th, we open the fitness rooms at 4 of our community centers: Madison, Fairlington, Langston Brown, and Thomas Jefferson, by very popular and emphatic demand. But we will be following very specific public health protocols in each of these fitness room settings. Most importantly, we are urging everyone to not get complacent. The virus is not going to go away just because we are wearied of it, and we really need everyone in Arlington to continue to do things like maintaining physical distance and wearing a mask and staying home when you can stay home.
Great. So hello, everyone. And I just want to add a little bit of sort of a census, a few statistics about what everyone's been doing. There are good things that have been taking place to support residents and businesses during the very, very difficult months. We partnered with almost 70 community organizations to distribute nearly 50,000 face coverings through churches, synagogues, nonprofits, and PTAs, who are helping us ensure that residents that need face coverings get them. We have also received over 5,700 calls on our COVID hotline, 703-228-7999, to answer questions about COVID testing, government services, food, housing, and more. We can't be everywhere, and therefore we really appreciate the community's help, all of your help, in identifying 360 reports of concern regarding social distancing and face coverings on our online reporting tool. To date, over 225 businesses, multifamily properties, and religious organizations have signed on to our We Are Covered program, which provides them with badges to show customers and visitors that they're committed to upholding Virginia's requirement for face coverings in public buildings. We encourage other multifamily buildings, faith organizations, and businesses to join in this effort. Since June 15th, Arlington Public Library cardholders have checked out 16,000 physical items from Central Library and placed 43,000 holds. We have now received 97 applications for what we call temporary outdoor seating areas, TOSAs, to help Arlington restaurants reopen and expand their outdoor space. And as of today, July 10th, 66 have been approved across the county. As of May 3rd, we had 15,068 unique connections to our free Wi-Fi hotspots around the county that were established to help address our acute concern about digital divide. In May, the board allocated $500,000 to provide broadband internet access to APS students in need. That grant, allocated as part of the Federal CARES Act, will provide free high-speed internet access to approximately 1,600 households with students in summer school and those who had requested MiFis. About 5,000 households will eventually benefit from the program. There are approximately 8,300 students on free and reduced meals, so this is a great way to try to serve as many as we can with Wi-Fi access. Speaking of hunger, the Cooperative for Hunger-Free Arlington has been working with partners to serve over 24,300 meals over the past several months. We've also provided $3 million for 1,400 households for rental and other emergency assistance so that our neighbors can stay in their homes and work to avoid evictions whenever possible. And we've paid out almost $2 million to over 280 small businesses in Arlington. This is part of our Business Emergency Grant Program, providing financial assistance to Arlington small businesses impacted by the COVID-19 pandemic. That's 394 businesses and $2.8 million awarded in a program that I'll stack up alongside or even ahead of the PPP program on the federal side. So those are numbers. Let's get to the questions, and we have two ways of submitting questions. Over to you.
Thanks so much. And of course, those two ways are either posting in the chat box of the Facebook page. Really appreciate those of you who've submitted questions already, or also call the phone number, which is listed along the bottom of the screen. All right, so I'd love to begin with our special guest today, Lisa Fikes, who's the Executive Director of Volunteer Arlington. And I wondered if you could share with us some of the ways volunteers are playing an important role during these COVID times and what those who want to get involved and support their neighbors during the pandemic can do.
Thanks, Katie, and thanks, Matt. When I think about volunteer engagement in the midst of the COVID crisis, I'd be remiss not to mention the work and the partnership that we've been working with Department of Human Services, with Anita Friedman and Kurt Larrick and their team, with Emergency Management, Aaron Miller and Samantha Brand and their team, and with libraries, Diane Kresh and Alex Geller. This public-private partnership really has been wonderful to see enacted in the midst of the COVID crisis. So many thanks to my teammates in the midst of volunteer engagement. As the COVID crisis hit us in mid-March, obviously the needs were increasing on a daily basis. And what we saw unfold was the solid volunteer structures that were already in place continued to be enhanced. Let me give you some examples of that. The Medical Reserve Corps has been alive and working hard. PTAs that were already functioning well were ramping up their efforts with food pantries. Specifically, I'd like to highlight Randolph and Barcroft for their work with the food pantries and distribution. Faith communities that were already alive and working, Our Lady Queen of Peace and St. Charles have ramped up their efforts with food pantries, working with volunteers to serve the needs of the community. And then when we think about the nonprofit work, specifically around the areas of hunger and around health and around emergency services with rental assistance, big shout outs to the volunteers that are working and continuing to work with AFAC, with Arlington Free Clinic, and with the work with Arlington Thrive. Also, another shout out for county employees. Where they are employees, it's been remarkable to me to see how the employees are doubling down and doing 2 jobs, 3 jobs to meet the needs of the community. So big thanks to them. The big need for physical volunteers once mid-March hit us was with food distribution. What's been especially touching to me to see is that the moment we got wind of needs and they were posted on the Volunteer Arlington site, the Arlington community has been so quick to fill those needs. And it's been remarkable to see how quickly those needs were filled once they were needed, whether it was for food distribution with our affordable housing units, with more volunteers for AFAC, or with the Cooperative for a Hunger-Free Arlington. Those volunteer needs were filled quickly. So a big thanks to the community. Clearly, with social distancing in place, we wanted to make sure that those needs were being taken care of, but we also needed to pivot and think creatively of ways that people could be engaged virtually and from the comfort of their own home. And what's been really inspiring and touching for us to see is the way that the community has done that triple-fold. There are wonderful ways to get involved with supply drives, and you can find those on the COVID-19 Care for Community page at Volunteer Arlington. Everything from Amazon wish lists that specifically name what's needed for the various nonprofits, to supply drive-throughs that the county have supported, as well as things like through doorways on Fridays. People making tons of masks, which have been wonderful and a huge contribution to the community. anti-boredom kits for bridges, and all of those needs are still listed on the COVID-19 page. And so I would encourage everybody to visit that page and see where they can help. In addition to those supply needs and ways that people can engage, the physical needs with food distribution, it's also been really fun to see the creative ways that our nonprofit and county organizations have pivoted to engage virtual volunteers. And so if people are interested in giving back and volunteering in this way, again, I would encourage you to visit that COVID-19 page, whether it's skilled remote mental health care counselors with Arlington Free Clinic, friendly callers with some of our retirement communities, virtual tutors with some of the affordable housing units and with Aspire, crisis link hotline volunteers with PRS, or one of my favorites, the volunteers. If you'd like to advocate for a specific organization and volunteer from the comfort of your home, there's some wonderful ways to get engaged there. Bottom line, what's been wonderful to see is that at the root of it all, it is neighbors helping neighbors, whether it's with the Arlington Community Corps, through Nextdoor, through various Facebook group pages, or the old-fashioned way of just going and making sure, calling your neighbor and seeing if they need any help and taking care of that need. That spirit is through all corners of Arlington and will continue to be as we continue to work our way through this. So please feel free to join us at volunteerarlington.org, specifically at that COVID-19 page, and see how you can get involved. Thanks.
Thank you so much, Lisa. And before we let you go, I think that you have a particular event to talk about some of these community volunteer leaders upcoming. Would you like to say a word about that?
Sure thing, thanks. On Tuesday, July 14th at 5:30, we're going to be hosting Arlington Cares. And normally that is an in-person event, but this year it will be virtual, so you can watch it from the comfort of your home. You can find that at the Volunteer Arlington page on YouTube or on Facebook. It'll be streamed on all three of those platforms. And we're going to be celebrating the spirit of volunteerism. So everything we just talked about and the wonderful ways that people have always been helping and continue to help in the midst of the COVID crisis, those will be highlighted with some specific stories, as well as honoring those who have given 100 hours or more of service. So we invite you all to join us at 5:30 on the 14th.
Thank you so much, Lisa. We're so glad to have you today. And it's a real bright spot, I think, in a challenging time to see the way community members have stepped up, particularly the winners of the Volunteer Arlington Awards. So we'd like to get now into some questions, including many that were coming in over the chat. We'll keep Lisa with us. If anybody has questions about volunteer opportunities, we'd love to hear them and engage Lisa to answer. But to start with, we've seen a lot of queries about phase 3, questions about what our testing status is looking like, what trends we're seeing, and a few questions about what let me frame it this way, a few questions about why the state is moving ahead with phase 3 and potentially Arlington's role in that. So I'm going to start with Dr. Voorhees, I think, in just talking a little bit about phase 3, what phase 3 means, and also what we're seeing in the terms of the data that perhaps led the governor to enter phase 3 and what we're seeing now.
Okay. Well, thank you, Ms. Crystal. It's glad to have this opportunity to talk again about a meet like this. So phase 3 is the governor's recognition that, as things have improved, the ability to slowly reopen society and allow people to get back to as much as normal as possible. To realize, I think people have to realize this is done still with the recommendations of public health, that 6-foot distance is kept, using face coverings when you go out, and to stay at home as much as possible if it's not necessary. So I think people need to realize that the governor's movement is part public health and part how do you allow for society to do what it believes is essential at the same time in a controlled fashion. So I think some of you have heard me talk before about opening and closing the faucet. And so we're doing this gradually, and I believe that's what the governor is doing, is gradually increasing the number of people who are allowed to come back together and then seeing over time what's happened when that's occurred. We have not seen a significant bump, but as you did characterize, Ms. Crystal, we've seen almost like a plateauing on some things, which is not surprising. The virus is still here. We're gathering. There's no other way until we have a vaccine that we're not going to have COVID present. And I'm happy to actually go into some numbers now, if you'd like, and then I will. So the latest numbers from this morning. Let's start with the Arlington numbers. We've had a total of 2,590 people who have been diagnosed positive with COVID. We are at 133 deaths. Unfortunately, that's happened here in Arlington. In the National Capital Region, which is the entire DC metro area, there are 83,490 cases and 3,155 deaths. So it's very sobering to always say those numbers out loud, and remembering that this has had a real impact and will continue to have an impact is something that I think this community recognizes, and I'm very appreciative of everyone's efforts to try to do the best they can. And as our county manager this morning told the employees, we also need to be gentle with each other, because it's not so easy always to do everything perfectly and correctly.
So I'm going to smuggle in a follow-up question before I hand things back over to Matt. We've heard from a few people interested in what happens if our numbers don't just plateau, but actually start to increase again. Is there a possibility of reverting to phase 2 based on those data?
Well, from my perspective, it's a great question. We've always in public health maintained that reopening implies also reclosing, because the public health, we're following the health and science, sort of the metrics. However, obviously, it's going to also have to be something that the political frame has to actually be comfortable with as well. 1 or 2 days, in my opinion, we're not going to say suddenly reclose or move back to the previous phase. We're going to look over it. Something that the region should know: the 5 health districts in Virginia, in Northern Virginia, Arlington, Alexandria, Prince William, Loudoun, and Fairfax, the health directors, including myself, meet every single morning, Monday through Friday, and if necessary on the weekends, to talk about these things. If we saw that, we would be advising our officials and also advising the state, saying, what should we do? But that closing or reopening is ultimately a governmental decision outside of public health.
Thanks so much. That's a great example of the turning the faucet on and off. It can also be turned back off. Matt, over to you for the next question.
Sure. So your smuggled question was the one I was going to ask, so we took care of that. I do think it's fair to say that many Arlingtonians look at the numbers every day, and I know I do. And, it's really comforting to know that the public health experts are looking at those numbers and talking to each other in the region. That's essential. And our numbers have been lower, frankly, than the rest of Virginia. In Northern Virginia, we've been lower, so that's good. I'll just answer one question on evictions. There's a question about whether we did a letter early on and out to our multifamily landlords. And just in response to that question, can we do another such letter? And we are actively considering such a communication. So more to come on that over the coming week or 2 weeks. And then a question about masks that came up, and I wondered if, Aaron, you might be able to help with this. And that's, in addition to the masks that we have provided, what if you need a mask? Are there ways in which, if there's a critical challenge and you need one, we don't have an unlimited supply, but there are some for those at some sites.
So a number of our nonprofit and community partners have cloth face coverings available for our residents. And so if they are serviced by one of those nonprofit or community partners, and so I'll use an example, APA is one of them. Those organizations have been working with the county and as well, thankfully, through the partnership with Volunteer Arlington to be able to coordinate receiving those face coverings and helping with the distribution. I will say that our website also has a list of places within the county and other resources where you can either create your own cloth face covering. Remember, you can do that with a bandana, with pieces of an old t-shirt or things like that. So we have videos as to how you can create your own face covering, as well as places within the county that you can go purchase, or some of those nonprofit and community partners where you can receive face coverings. And that link is being put in the chat right now.
Great, thank you. And just to note as we rush to more questions, Aaron has not yet pulled out the razor, but I've done a haircut after 6 months, so I hope you'll tolerate that as we've been working flat out. But over to you, Katie, for more questions.
Thank you. I just want to acknowledge and reflect that we have been receiving probably at this point over a dozen questions from teachers in particular, and with others concerned about the school's blended approach of some in-person learning for some students and the rest virtual learning. We have heard quite a bit about this as the county board, as I'm sure as the school board even more so. And I wanted to just take this opportunity to talk about what we as the county board are doing to partner with our schools. I think some of our most important roles are supporting the school board and superintendent with public health advice, tracking the fiscal impacts so that we can help meet these needs, and staying in close coordination so that we can help understand the community needs for childcare that result from the models that the schools adopt. We don't have anything yet to announce today with regard to childcare. I believe that we are going to be most focused as the county partner on trying to address the needs of our most vulnerable families for whom a co-op model or paying outside childcare just isn't feasible. Beyond that, I think we also see opportunities to try to help provide health and safety guidance, and if potentially helpful, facilitate networking for groups that can organize parent co-ops, and otherwise do our best to support this extraordinary need in the community. We've also gotten a lot of questions specific to the instructional models and policies about staffing and classroom cleaning. Although those are the purview of the school board, I can share that they've been getting and connected to our public health department for advice throughout. So I wonder if, Ruben, you wouldn't mind maybe saying a word about the partnership with the public schools and how your team works to provide advice to them in making decisions about keeping students and especially faculty safe.
Sure, great question. So I think people know that the School Health Bureau is actually, with our clinic aides and nurses that are in the schools, is actually part of the public health division. And so there's been this long tradition and history of us working collaboratively with Arlington Public Schools on communicable disease issues. So cleaning and disinfecting of facilities, we've done outbreak investigations. That's always been done in concert. And I think someone has even asked, if there were some sort of outbreak related to COVID, would we do some of the same things that we've always done? And the answer is yes. We could notify or recommend to APS leadership to send out the notification of specific schools if something has happened related to COVID. So we've been working with them. We've provided the guidance, which is no different than what we've given to you here to the county or to those on this call. We're still recommending things like staying at 6-foot distances, using face coverings when you're going to be unable to maintain 6-foot distances, but trying to get back to out of that range before 15 minutes have passed. Using those general principles, and then of course, if anyone is ill, we're asking them to stay at home based on their symptoms or their diagnoses. As we learn them, we can work with the school system to see if there have been contacts, if that's the case, and were there contacts in the schools. The way that the schools are designing it, as I understand it, and I've seen their plan, keeping kids together in small cohorts is a way to make sure that there isn't mingling across multiple classrooms, which would then mean more people could possibly be exposed. So we are working with them, and we'll continue to work with them. And so I hope that will at least give some people some comfort. I realize it's scary to think about reopening. Children and our staff are some of the most precious commodities here. And so I know that the leadership at APS is serious about trying to make it as safe as possible within the guidelines we've provided.
Thank you so much. And keeping those smaller groups of kids together, but 6 feet apart, right?
Correct.
Matt, over to you for the next question.
Sure. So I think we also just have to acknowledge how challenging a moment it is for parents. And we are partnering and working with APS, being mindful that the school board and the superintendent have a leadership role, and we're partnering and cooperating, but we're focused on that. There's some other questions about testing and tracing that have come up, and I think this is a question for Ruben or Jim, perhaps Aaron. It's regarding what are we doing to ensure we're continuing to have testing available? Do you need an appointment for testing, and how can the uninsured get help with testing? So that's the testing, and then there's what are we doing to make sure that we have those tracing components? Maybe
Do you want to do the testing thing about
Sure. Sure. So on testing, two things. So the county, as you know, had partnered with Virginia Hospital Center to run one of the first drive-through testing sites, sample collection sites in the National Capital Region. Virginia Hospital Center, as board member Crystal mentioned, had to pull its resources back to the hospital to handle the growing demands from elective surgeries and other important medical needs that had been deferred because of COVID. The county was able to partner with Quest Diagnostics, and this week reopened the North Quincy site. That site is available to anyone with a doctor's order, and it does not require an appointment. We'll put the link in the chat box for more information about accessing that site. But that site is open and available, and we wanted to let people know about that. Secondly, when it comes to Arlington Mill, the county has partnered with the Arlington Free Clinic to offer low and no barrier testing for those that are uninsured and underinsured. And this is very important. And Ruben can talk about this a little bit more. But Arlington Mill site is specifically designed for those residents who we know have access have problems accessing regular health care. That site is designed to help provide them these necessary services and access to these services in a low barrier way so that we can help protect all residents within the community. It's not just about getting the test, it's also about what happens if, for instance, you have a positive test, right? It's making sure you have access to follow-up medical care. It's making sure that you have access to necessary wraparound social services through our Department of Human Services. And so that's what the Arlington Mills site is designed for. In regards to the general availability of testing, I will say that we've continued to increase not only our offerings, and so the number of spots and slots that we have available at our events and at our sites, but also with our private providers. And so I'll say things like CVS's in the region, for example, Minute Clinics, private practices like the Inova Respiratory Clinic. All of them continue to offer availability. I'll speak frankly here. As part of the problem with no organized federal strategy, we at the local level have been faced with developing a strategy and implementing in a patchwork manner. We've done our best to partner with our public and private organizations to continue to offer as much availability for testing as we can. And that's one of the challenges, frankly, that we've faced. We think that the VDH website offers you a wide variety of avenues to access multiple testing opportunities. And in partnership with Quest and with Arlington Mill and with the Free Clinic, we're going to continue to expand where we're able to.
And so on contact tracing, but before I get to contact tracing, the opportunity at Arlington Mill was something that the Virginia Department of Health is an initiative for all areas with low income, underinsured or uninsured individuals. And so the Free Clinic was willing to step up and be the one who registers the people following the social safety net service provider guidelines to have those individuals have this access, because they really don't have the same ability that many of us do to have private providers and insurance to get the testing done. And so public health was here as part of the Virginia Department of Health, and we wanted our community to avail itself of this. And I think, as everyone has heard before, and I'll reiterate again, it's this population that is disproportionately affected by the infection. And a number of these individuals, because they're also low income, work as essential workers. They must leave their home. So their exposure risk is higher than those of us who are able to have the luxury, in one sense, to stay at home. And so that is why we're trying to reduce their exposure, or at least then quickly identify those who are at risk, to hopefully allow them to isolate and get the care they need and not spread the germ further, either amongst the people they live with or the rest of us in our communities. So enough on that. Contact tracing continues. We are switching to try to have a more permanent structure in our county, but we still have people doing contact tracing. Our numbers have not gone down in that. We still have the capacity to ramp back up to deal with the cases as they come. We didn't suddenly shut down our operations. We're training them in new things, and they're still making those calls. And then we do active monitoring with those individuals. And for those who need support, we're connecting them to the services to allow them to stay at home. And you only imagine if someone who's ill and worried about making rent, if they don't have those resources, they're going to go and work. Who would blame them if that's their circumstance? So we as a county have provided the resources, both public and private, to help people be able to actually do the right thing. No one should have been put in that position to begin with, but that's a larger discussion for another time.
Great, thank you. Real detail on that. And so if you're in a household and you have a positive test, it is important to call our main line, the 97999 or the 703-228-1300 if you have needs. So really appreciate that, Ruben. Katie.
Great. So a question maybe for Jim and Aaron, which is we've heard from a few folks who are concerned about their apartment or condo building, or in at least one case, their business owner not taking the appropriate precautions within a space they need to be, whether it's to perform a job that they need or simply to live and be able to exit their apartment and ride common elevators and be in common spaces. What advice and resources do we have for people who are in an environment where they need some enforcement to be able to work and live safely?
So I'll start, and Aaron may have some to add. You know, I think overall, when we talk about social distancing, you know, we're working against habit. We're working against what all of us have grown up and matured to do, and what human beings typically do by way of gravitating towards each other. So that's perfectly understandable. What that also means is that we need to be sort of hyper vigilant, hyper aware of our surroundings and where we are. And it is an unfortunate state of circumstances that some people, for whatever reason, have decided not to abide by the mask orders or not taken advantage of the protections that face coverings or masks provide for their fellow person. In multifamily dwellings, in the cases where there are hallways that don't easily enable social distancing, again, we would start with everybody, encouraging everybody to wear a face covering, and then, monitoring their movement when they step out of their apartment, when they step out of their enclosed space and have the need to wear that face covering, look up and down the hallway, see, what kind of traffic might be there. And it's also important to understand that if you're just passing somebody, especially if you have a face covering on, if you're just passing somebody, the risk remains relatively low. So again, encouraging people to stake out their area before they start moving, wearing a face covering is important. To the question about businesses that are not encouraging or abiding by the governor's order, because the governor's order in phase 3 is that whenever you go into a commercial or public space, you must be wearing a face covering. To the extent that some people may not be abiding by that, as been spoken about before, we'll take complaints about that and do some follow-up to see what we can do to encourage. But perhaps the best thing that people can do when they see those circumstances is to vote with their feet and not do business with those establishments that have chosen not to follow the legitimate order of the governor. Find another place to do your business. Find another place to, buy whatever it is that you need. We've been really successful at our campaign to be covered. We have many businesses that have joined us in that campaign. Look for those. The placard, the poster that we have given many businesses that announce that they are part of the county's effort. And if those don't, or if the business that you want to go to doesn't have those or isn't practicing, go do business somewhere else. Aaron, other thoughts?
All good.
Great. And we do appreciate too for those who are in workplaces where their managers are choosing not to follow the ordinance, that we recognize you're in a really tough position. I do believe there are opportunities on the Virginia OSHA webpage that we could try to share for you to submit a complaint for the state to follow up on. And if you think some soft persuasion might help, we can also share a link for our We Are Covered program that Jim was just referring to. That may be a way to encourage your place of business, your house of worship, or even your apartment or condo building to be a little more attentive to these issues by taking the pledge and receiving more information and guidance.
Great. So we're seeing a number of communications from teachers who are very concerned about your safety. And since I started my career as a teacher, it resonates. I was in a call recently where teachers spoke of their concern with a regional call with the Secretary of Education describing some of the, for Virginia, describing some of the challenges. We are absolutely concerned, and we are also mindful that Dr. Duran, as superintendent and the school board, have steps that they certainly want to take. The question that's specific that I want to just pose, maybe it's for Jim, it's about school buses and whether the county side we've had any collaboration or thinking about safety, because it's certainly the regular school buses with the regular number of students is not consistent with social distancing. And I know we're collaborating. I also know it's an APS school board and superintendent question, but Jim, do you want to add?
Actually, Mr. DeFranti, I probably defer to Ruben on this, but just, to say that the social distancing parameters are going to apply on buses as much as they are in other indoor spaces. So, Dr. Varghese.
Sure. Now, the schools are considering the same social distancing recommendations from public health for transportation as well as in the classroom. And it's been a difficult discussion for them. And I know that's what the entire region and the state has been dealing with. So they are still working out those details, but they know the public health position as indicated.
Sure. So that's helpful. Just so folks are on level setting, the superintendent did mention that masks in the classroom are going to be a key part of the plan. And so that's one thing. And I'm also mindful that teachers you're concerned for your safety. You're also concerned for your students. And so we appreciate and understand both, even as APS school board and the superintendent are the leads that we're partnering with on this. Over to you.
Great. And I think I might have a chance to follow up pretty quickly on the most recent question asked, which was hearing from people that, certain members of a staff in a store, the owners don't need to wear masks, or that there were laws against mask wearing in Virginia. We can say that all of that is inaccurate. The governor's mandate is that anyone inside of a building or indoors in any capacity ought to be wearing a mask. And so please do follow the channels that were described earlier if you're concerned about that. We are getting some interesting questions about what it looks like on the other side of contact tracing. So we've talked a lot about the contact tracing program that we've been staffing up, that they've been doing that important work. But if you get a call from a contact tracer, for example, and this relates to the school's questions, say a child in your school's classroom was diagnosed or has a family member that was diagnosed with COVID-19, what would that contact tracer be encouraging you to do?
That'll be, so maybe it would be good to start a little step back and if we get a positive case, we first talk to that case and find out first that they're doing well, and also making sure they understand what they need to do to keep themselves safe and not spread the germ. And so that information is the first thing we really talk to them about. We then find out from them who their contacts would have been and determine which ones are likely to be within 6 feet for more than 15 minutes. Because it's not all contacts, it's those who have spent 15 minutes in distances less than 6 feet, and it's cumulative over time, not in one visit. So using that same concept, what we would do in a school is if we learn from the school system that someone is positive, we will want to know where they were, and given their current plan, as I understand it, and based on other things, these are going to should be limited numbers of people who come in contact, because if they're staying in one classroom, for example, and know who comes in and out of that classroom, and they're going together, say, to lunch together, safe distance and so on, and we know who's on buses, we will then be able to say, all right, which maximum number of people may be at risk, and then based on that, we would be able to put out notifications to those classrooms saying this may have occurred, and then we would contact anyone who's considered a close contact, but the school may decide, okay, we need to close this one classroom for at least the next several days, and then whoever was not a close contact could return to that classroom. Because not everyone in the classroom will necessarily be a close contact, because if you're in one corner of the room and your child is in the other corner, they're going to be more than 6 feet away, and if the school system has done what they're saying, then that child will not be considered a close contact unless the information on the virus changes as we learn about it, if that helps.
That is, yeah, thank you for that detail.
Great. So we had a question really quickly on gyms and whether they're safe to use. There is a slight shift. 75% capacity is the limit in phase 3 for gyms. We also, probably Dr. Varghese, there's also, you want to be really smart about how you do this. And I think there's a 10 feet between folks at a gym, but Dr. Varghese.
Sure. So I know from the beginning, I was recommending that for those who are staying at home, that exercise was still important and to get out. And so exercising and the use of the gym, all very important, and we need people to do things safely. So one of the reasons why you'll notice that there's been a change in the distance when you're exercising. The normal distance that we've been advocating is 6 feet. But in a gym or any activity that's with other people in an exercise capacity, it's actually increased to 10 to account for, in many ways, the ability of that extra heavier breathing, similar to singing and so on, that it could expel more air, expel further germs if you happen to have it. And that's why they want exercise equipment to be at 10 feet, or you'd be having spacing between, many of us have seen treadmills all in a row, so you won't be next to each other, and it'll be at least 10 feet if they're in compliance. So that's the concept. We've also recommended that for swimming, that if you're going to be swimming, it's a 10-foot distance. It's odd, and yet we're trying to have the right balance between allowing people to do what they'd like to do and not come in contact or extra contact or risk from germs. We're all at risk from being in a pandemic situation. Some situations are riskier than others.
Got it. Thanks.
So Ruben, I'm sorry, we're not giving you a break yet. I have a really interesting set of questions that have come in related to our neighboring states. So not just what's going on in Virginia within jurisdictions, but knowing, for example, that Carolina and other states on the southern part of the East Coast have seen pretty significant upticks. Can you talk a little bit about how the coronavirus moves from population to population, how we're thinking, and you and the other Virginia health directors are thinking about the impacts of viruses of the virus in other states and increases in positive tests in the other states on our efforts here?
Sure. This is going to be a flux that our whole nation, as well as Arlington, is going to be facing, because we don't, as Dr. Miller talked about, we don't have a federal strategy. And so if we don't have one approach to it, each state has a different approach, but they all appear to have the same public health approach. So what I said to employees this morning, if they're traveling on business or for pleasure, it applies to the same things for our region as well. We're still recommending wherever you go, it could be a higher number of cases at the moment, but remember there was a time when we had higher cases, so the same applies. And even in our region, there's a little bit of difference. So the same principles still apply. When you're traveling, I hope it's for essential reasons. If it's on vacation, the same rules still apply though. Stay at home as much as you can, enjoy your environments. If you're at the beach, still keep 6-foot distances, use the face coverings. Those principles are universal across the US and across the globe. If you're a US individual, Those are the things you should be doing at all times. So that's the thing that'll keep us protected. Making sure that we're not suddenly, when you're on vacation, liberated from those. We've had some reports of people making their high school or college graduation trips to beaches. I'm not against the beach, but if you then suddenly say that you can interact with each other and not follow those rules, well, we've seen that across the region, across the nation, that people come back more infected. So be smart about your travel. It is no different than the actions that we take here and recommend.
Dr. Verghese, that's really interesting. And I think one of the takeaways I heard is that our biggest concerns are actually Arlingtonians who are living, working and playing in our community, going out, contracting the virus elsewhere, and then coming back, because that's where the spread might be greatest relative to, for example, somebody passing through Arlington from another state.
Right. I would worry about we never replace our own majority. I mean, in a sense, yes, we used to have a lot of tourists. They still weren't the majority of individuals. And so let's focus on doing things right here. And we're putting out those same messages. I know it's not a good thing, but I don't think we're a major tourist destination at the moment. And unfortunately, from a public health perspective, I'm very glad about that. I apologize, that has economic impact.
Thanks.
Sure. So a couple of detailed questions about testing positivity rates, which I think we've kind of addressed, but there's one other that I just want to seek to be this transparent about, which is there an impact? Do we see a disparate impact based on race? And Dr. Verghese, you probably looked at the more recently, but the last time I looked, certainly our Latinx population has many more infections. And it's painful, but when we look at the fatalities, we do see our black residents have a greater rate of fatality. And I think this touches on the structural issues with respect to resources for public health that is a longer conversation, but we also need to focus on right now. So I don't know if probably the bigger part of that question on race is the bulk of it, and we can come back to the infection rates. Positive rates.
So even though things have improved in our numbers, those who are at risk, that risk profile doesn't change, because the at-risk factors, especially those that are related to our structural racism and so on, are still present, and it's not something that we can suddenly correct for here in Arlington or anywhere else. And I want to make sure people realize it's not just an Arlington problem. However, we in Arlington are trying to at least deal with the immediate issue, at least in public health. Are we putting the resources where we need to make sure that they have access to testing, for example? It's why the Arlington Mill site was selected, because it's where it's that nexus of we have a government building that is more easily accessible, that we can have in a community where more people are affected. To your larger point, though, until we as a society can make sure that I can no longer look at someone's skin and predict their outcome based on how they look, because I can easily predict that a person who's a person of color is more likely to have medical conditions, be lower income, and these are things that end up putting people at risk for having either the inability to stay at home, and then they get exposed to germs, and then if they're exposed to germs and have medical conditions, it then means they're at higher risk of having complications from diseases like COVID. Same thing happens with TB. This happened with H1N1 when we had that pandemic. These things matter, and I'm hoping this nexus of time between the pandemic of COVID and the pandemic that we've seen with racism, we may finally see they're interrelated, and we can try to do something in this community and elsewhere beyond just the COVID situation.
Great, thank you. We are taking responsibility and doing what we can to address some of these disparities that pre-existed the pandemic, while mindful that our whole country needs to change towards a fairer system, and we have our own responsibility there. So over to you, Katie.
Excellent. So we've already talked about gyms and staying safe in gyms. What about houses of worship? What does phase 3 prescribe relative to houses of worship, and how can individuals in our community stay safe if they are going to worship out of their homes? I'm actually not sure who I'm directing that question for. Maybe this is a Jim question with regard to what phase 3 says, and a Ruben question for practices to stay safe.
Yeah, Katie, I'm gonna defer to Ruben on both because I'm blanking on what the latest with phase 3 is. People will recall that houses of worship actually had a little bit more flexibility in opening in phase 1, and to be honest, I've lost track of where things are in phase 3. So perhaps Ruben or Aaron knows off the top of their head.
That's a great point. When you think about the dozens of features of public life and the evolving guidance on each of them across the phases, that's pretty reasonable.
Yeah.
Well, I'm having the same blank on one portion, which is the exact requirements, but I can talk about the second, and I'm hoping Aaron, with his speedy fingers, will find the answer to that, because I can't find. I've got the document open, but it's 47 pages, so I haven't found it yet. Even in a church setting, one of the things that you need to do, there's the difference between what someone may be required to do and what your best practices should be. And it goes back to some of the things that Jim Schwartz talked about earlier. You need to make sure that you're following 6-foot distances and that you're using face coverings, and that can apply even in a religious building. So that is a personal decision that you can make, okay? There are going to be issues about whether you can safely take communion. I have written, and it was on our website, about what should be done during communion during periods of COVID, and it's still up there. If that's your faith tradition where communion is part of it, a shared chalice, for example, is something that I would not at all encourage. And you will see the science listed that I cited, or the lack of evidence of the science. People have said, oh, gold can, prevent germs from spreading. It's like, okay, but if the germs are actually there and you're sharing a common cup, you're having an exposure risk. So we've been saying, find a way to practice the faith without necessarily putting yourself at risk for germ exposure. And so that is where I would advocate. And Aaron, looks like under the rescue here for the actual verbiage.
Sure. So there's a couple of things, and there's a graphic for Virginia phase 3 that I will ask the staff to put up. I think they know the one that I'm talking about. But essentially it shows the differences between phase 3 and phase 2 and 1, and for by specific sectors. And so it provides you a little bit more information there, but I'll just go through some of the specifics about houses of worship. The phase 3 guidance in the governor's executive order still encourages Virginians to seek alternative means of attending religious services. It still recommends using drive-through worship, using virtual services, or those, quote, non-contact or non-congregate methods. Where services are held, it's required that individuals be seated at least 6 feet apart, and that they have to maintain physical distancing at all times. They do have an exception in there for family members. Obviously, if it's some sort of religious service or ceremony for a family in a small group. If there's any items that are used to distribute food or beverages, so an after-service event or anything like that, they have to be disposable, they have to be used only once, and there are still certain guidelines about maintaining non-communal use, right? Non-communal service items. So that information we'll post in the chat and make sure that everyone has it.
Great. So I just wanted to follow up on the question of the positivity rates with respect to tests. And Dr. Miller, I think maybe if you have some thoughts on that. I do check that every day, and yet we know that daily is not as good as the trend, and you guys look at the trend.
So I'll start this, and I'll let Ruben pick up a little bit. So the test positivity rate that you see on the Virginia Department of Health COVID daily dashboard is what's called a rolling 7-day average. So it uses the prior 7 days as the snapshot for that metric. And yes, you're right, and I've seen this within a number of folks in the chat box, our rolling 7-day average test positivity rate has gone up in the past 2 weeks. That is because you may remember we had a very large testing event at Barcroft. That testing event had over 1,000 individuals tested and an extremely small number of positives returned at that testing event. As a result, because of the math during that window, that caused a decline in our test positivity rate. What we're now seeing is it levels back off for PCR only somewhere in the neighborhood of 5.5 to 5.6, which from what I remember, and I'll let Ruben expand, is in line with the rest of Northern Virginia and about what we have been seeing prior to having that large testing event, that decline and level off.
Dr. Miller has that quite correct. If you think about it, if you just remove that 1,000 test day from it, we would have remained roughly at about 5 to 6%, which is well below the 10% that we've been looking for. And we're expecting some degree of positivity because we know the virus is present. And so this is why some places could think of it almost, you could artificially make your test positivity rate go down if you end up offering it to everyone and most of them aren't sick. The only way we could know for sure would be a one-day testing event for all 220,000 Arlingtonians, get the result back. We would then know how much is present in Arlington, which would be a fabulous number. I'd love to learn, but I don't think that's going to happen anytime soon.
Thank you. And I know that was really a continuous theme throughout. Folks definitely very keen, reasonably so, for the reasons you just mentioned, to try to ramp up testing throughout our community, which I know, Dr. Verghese, you spoke to earlier, we're certainly working to do, have been doing at the county level, and we hope that we'll start to see a greater presence of private partners, such as those CVS Minute Clinics within Arlington doing the testing as well. All right, one final question to wrap up, since we are now doing these bi-weekly. So for anybody who might be, I don't know, taking a trip to the New Jersey shore between now and then, great question. If you're traveling a long distance and you have passed through high-risk states, maybe stopped at a convenience store or a rest stop off the turnpike, should you quarantine yourself once you get home?
Okay, excellent question. I think that's probably directed at me. So maybe one of the things I have to remind people, when we say stay at home or stay at home longer, that's essentially our recommendation to quarantine yourself for most of your day. So likewise, as I said, people where you may be traveling, we may be the source of greater infection risk from where we are, because there are places that are doing better than we are, for example. So unless there's a specific reason to believe that you have been exposed to a known case, really, when you're there and you're here, make your vacation plans to do what you do here. Stay at home as much as you can. When you go, gas up and so on. Are you doing it in the safest way possible? Do you have hand sanitizer with you? Are there facilities with soap and water that you can access? Those are the things that you need to do either on vacation or here. So I think it's a good question. It was a great opportunity to remind people, when we have you stay at home, we're essentially asking you to quarantine. You are self-quarantining at those points.
Thanks. All right, Matt, any final questions, or is it time to wrap up?
I think it's time to wrap up, and maybe I'll just start with a couple of things and then you can finish us out. We did hear just one little question about how can you advocate for increased testing, and certainly contacting your delegate or senator, but also the governor are all important steps that you could take. I'll mention, I think it's important to reiterate that we hear your questions and concerns, both as parents and as teachers, and that is a huge, perhaps one of the biggest issues other than keeping the rates low for the coming weeks and months. So we should be clear that the decisions about how to move are primarily the school board and the superintendent's responsibility, but that does not mean that we're not working with both at the staff level and at the county board level. And it does not at all mean that we don't care deeply about the safety and health of all of our teachers as well as our students. So with that, I'll just say three words, that vigilance is critical, and it's a mask, wash your hands, and socially distant. It's still paramount importance because we don't want to be in the situation that so many other states are in that we see nationally. So thanks, and over to you.
Great, thank you. I just want to continue to echo the comments that Matt has made so compellingly, which is that we're hearing these very specific questions about school practices and policies from our teachers. We value you. We hear those questions. I know in the chat box, our team has shared some details about 2 upcoming APS town halls. So again, the county board, the county manager are very committed to supporting schools through financial resources, through offering public health advice, and trying to focus on the community-wide problems that are presented by children out of school in need of care. But those very specific questions about, for example, the format of your classroom really could best be answered through those town halls. So we appreciate you coming here. I think we all benefit from hearing some of those top concerns that are on your mind as well. So in closing, I want to thank again the team who's joined us. I want to thank again Lisa Fikes, who's taken some time to be with us today. And again, really encouraging you all to register to join that Volunteer Arlington Awards on July 14th, so that you can hear a little more about some people doing extraordinary work here in our community. Our next COVID-19 town hall, Facebook town hall, will be 2 weeks from today. And you can learn more and find the date, find the specific times and link by following Arlington County Government on Facebook. So we look forward to seeing you then. Thank you again to those of you who joined questions. Please be safe and please take care of yourself and take care of one another. Thanks.
Thanks, everybody.